Hi everybody, welcome back to my channel. Today's video has been requested by a couple of people and it is going to be what I wish I'd known before my C-sections. It is just going to be tips for anyone who is planning a C-section birth, or even just anyone who's expecting a baby, because as we all know, birth can sometimes not go to plan. Like me, you could have a breech baby and have to resort to an elective C-section, or something could happen during your labour and you could have an emergency C-section, so it's always good to be prepared. So I hope that this video will give you some practical tips on C-section and preparing for a C-section birth, what to expect during it, and yeah, just the recovery as well. Because I think sometimes when you go to antenatal classes and stuff like that, most of the advice is in relation to natural delivery, and there's sometimes just a very small section on caesarean birth or none at all. So yeah, I feel that some people are quite unprepared for what to expect when it comes to caesarean, so hopefully you find this helpful. So for those of you who don't know, I have had 2 C-section births. My first was planned but ended up being an emergency because I went into labour. Both of my C-sections were because my babies were breech. But yeah, my first I went into labour and had to go in and have an emergency one, and my second I got to my date and had my elective C-section. So I kind of have experienced both types, although my emergency one was, you know, still relatively calm. It wasn't a really dangerous emergency or anything. But they were definitely very different births. So I'm going to kind of break it down into pre-birth, during the surgery and recovery. So my advice is, before you are due to give birth and during your pregnancy, whenever you're writing a birth plan, whether or not you plan to have a C-section, even if you plan to have the most natural birth in the world, put effort into planning for a positive C-section as well. I did hypnobirthing and had every intention of having a lovely, beautiful, natural birth with as little intervention and pain relief as possible. And then my babies were breech and that all got took out of my hands. And my first pregnancy, I was absolutely devastated. I cried for days after finding out Jonah was breech. I tried everything to turn him. I just was absolutely devastated, and it was a really grieving process for me of losing out on that natural birth that I'd wanted. So yeah, I would say be flexible in your birth plan. Be prepared that there's a chance that you will need a C-section, because whether or not you have that plan of a natural birth, your baby might not cooperate. They might not be in the right position for a natural birth. Something could go wrong during your labour that means that you need an emergency C-section, and if you have prepared yourself in advance emotionally for that, you'll cope so much better with it. This pregnancy I coped so much better because I never clung to the idea that I was going to give birth naturally, even though I really wanted that again, and I really hoped for a VBAC. I didn't cling on to that idea and really get emotionally attached to it, because I knew that babies will do what they want to do, and as we've seen, Theo did exactly the same as Jonah. So this time I accepted it so much quicker, and I was able to prepare for my C-section a lot easier because I had emotionally dealt with the loss of my natural birth that I'd wanted. If you're nervous about the idea of surgery, I would really recommend using a hypnobirthing course, the same as I did. The one I used was Alice Kirby's online course, and she has an MP3 which is specific for caesarean, and I found it really helpful in preparing for my birth and thinking positively about my birth. It helped me to visualise my birth going really well, how I would feel after it, and it really helped me on the day to stay calm and to feel happy during my caesarean. I also used some positive affirmations which I kept on my phone and looked at throughout my pregnancy. If you look up caesarean affirmations on Instagram, you'll find lots of really good ones, and they just helped me to get myself into a positive frame of mind about my birth. Also, it's really important that you write a caesarean specific birth plan as well. When you're writing a birth plan, don't just focus on the natural birth side of things. Have a section in it for what your wishes are if you do have a C-section, because a caesarean is not a consolation prize that you get if you fail at a natural birth. It is still a lovely birth experience, and you should think about how you can make it as positive as you possibly can prior to giving birth, so that you don't look back and wish you had done things differently and feel that you missed out on that lovely positive birth experience. Look into gentle cesarean and things that you can do to make your birth more natural, even though it is a cesarean. So you can have the drapes lowered so you can watch the baby being born. You can ask to have skin to skin in theatre. You can ask to see the baby before they're cleaned up. You can ask to have the dad trim the cord. You can ask for delayed cord clamping, the same as you have for a natural birth. Some places you can have music on in theatre. Some places may let you dim the lights. I can't imagine that they would do that very often because they probably need the lights bright for surgery, but you can still ask. The worst that can happen is they say no, so make sure you ask all the questions you want and you know, have your plan in place. Okay, so I'm just going to talk a bit about what actually happens prior to and during a C-section. I didn't really know what it actually would entail and how things would happen before I had mine. So if you're going for an elective C-section, you will have a pre-op appointment a few days before where you will go. They will measure you for your lovely TED stockings, which are designed to stop you from getting blood clots. The nurse will shave you down there, I'm sorry to say, which is in preparation for the surgery, which is quite an embarrassing experience, but yeah, has to be done. They will weigh you to see what medication, what level of medication you will need, and they'll just talk you through the surgery, and they'll also give you your tablets that you need to take the night before and the morning of the surgery, which is, I think, some kind of it's for heartburn and stuff like that, I think, because you're going to be fasting and you can't eat anything from the night before. So yeah, you have to take that tablet the night before at 10 and then the morning of at 7 AM. So they'll give you all that and you'll get a chance to ask any questions that you need to ask, and they will then tell you what time to come for your surgery. So on the morning of your C-section, you will come to the hospital first thing, and they don't give you a time, they just tell you to come for 8 AM. And then when you get there, they'll give you an idea of what time of day your surgery will be. So I was the third person to go, so it could have been later in the afternoon, but they actually got through them quite quickly. So my baby was born at 12:25 in the afternoon, which was good. Not too late in the day. But obviously if emergencies come in, your surgery could be pushed back and back. So just be prepared. If you are having an elective, make sure you go there. You're not expecting that you're going to have your baby at 8 AM. You could be sitting all day, so be prepared for that. Download some of your favourite TV episodes or movies to watch while you're there. Me and Peter watched Game of Thrones to pass the time, and yeah, that helps put the hours in. So just be prepared. It can be boring. You could be sitting for a little while waiting, and it's good if you can have some stuff there to entertain you. All of the team who are going to be doing your surgery will come round and meet with you and talk to you, and that is your chance to tell them your birth plan, to remind them that you have your birth plan in your file, tell them you want the drapes lowered, tell them you want skin to skin, all of that stuff. Get it out there then so that it doesn't get forgotten about in the moment, because everything can happen very quickly, which I found with Jonah. We didn't get the drapes lowered with him. I think it was more to do with the fact that he came out quite unresponsive and he was needing to be resussed a bit, but in the moment we thought they just had forgotten to do it. So just make sure you make your wishes really clear and that everyone is on the same page and knows what you want to happen. And that's also your chance to talk about any worries you may have. The anaesthetist comes round and talks to you, so you can ask if you're scared about the spinal or something like that. You can ask them about it and get them to talk you through it, and they can provide you with some reassurance. So once you're ready to have your surgery, you'll be taken around to theatre. When it was an emergency, I got wheeled straight into theatre, and it was all a bit rushed and a bit crazy. People were coming at me from all angles, giving me tablets, shaving me, putting cannulas in my arm, everything else. Whereas whenever it was an elective, it was much more calm. I walked down to the theatre, Peter walked with me, I got myself up onto the operating table for the spinal and everything. Now, one thing is, your partner is not allowed in the room. I think in some countries they are. I've seen some videos of people in England or in America maybe, who their husband is with them when they get the spinal, but that's not the case where I live. Because it's a sterile environment, your husband's not allowed in, which is quite rubbish because the spinal is probably the scariest part for me. So that was the worst bit for me, and I do always panic a little bit just before I get the spinal, and that's the bit where I feel the most emotional, because it's just scary. It's just really scary. Someone coming with a big needle to put it in your spine. There's no way around it that is a really scary experience. So yeah, that is when I really use my breathing to try and stay calm. And I must say, like, the midwife is just so good at keeping you calm as well and talking to you, and all the staff and both mine were fantastic. So yeah, the spinal, it's the thought of it that is more scary. I won't lie, it's not a very nice feeling. It's a bit of a twinge, but it's not as painful as you imagine it's going to be. They put a little local anaesthetic in first so that it's not, you don't really feel too much pain, but you do feel a little tingle in your spine as it goes in, is how I would describe it. The worst bit for me is actually getting the cannula in your arm. I actually still have the mark from mine 2 weeks later. But the cannula that they put in to give you the antibiotics and everything is actually the most painful bit. The first surgery that I had, because it was an emergency, my veins collapsed and they couldn't get it in, so it took 8 tries, whereas this time they got it in straight away, which was great. Once that's done, and once your spinal's done, they help you get your legs up onto the table. It's a very strange feeling because straight away your legs start to feel a little bit funny and numb. And because you've got the bump, you can't actually see your legs. And the first time that I had it, I actually thought I could still move my legs. Like, I felt as if I was wiggling my toes and stuff. But it wasn't until the nurse came and asked me to raise my legs that I realised that I could not do that. And it is a really strange experience. You're numb. I was numb right up to here this time. And they test that really well, so don't worry about that. I find it hard to believe that anybody, I know it does happen, but I can't imagine how anyone could feel pain during the surgery, because prior to starting the surgery they do so many tests to make sure that you're not feeling any pain. So they run ice up your body and they'll put it on your arm where you can feel it, and then they'll run it up your body and ask you to tell when it's cold. They'll also pinch you really, really hard with a metal thing without telling you, so that they can test whether or not you can feel, and I've never felt it at all with either of mine. So yeah, they're really thorough in checking that you can't feel pain, so try not to stress and worry about that. So once you're all numb and everything's ready to go, all the staff in the room will introduce themselves, and it can be a little bit overwhelming because there are a lot of people in the room, because you have your anaesthetist, normally they have an assistant, there was 2 surgeons in mine, there was a paediatrician, there was a midwife, there was a sister midwife, and then there was scrub nurses as well. So a lot of people in the room, and they all introduce themselves, and then you have to introduce yourself and you have to confirm what procedure you're having done. It's just to make sure that you, I don't know, I think it's to make sure that you have your wits about you and that you consent to what's about to happen. So yeah, it can be a little overwhelming when you sort of realise the amount of people that are in the room, and the fact that you are kind of exposed because you're in a hospital gown and you've nothing on under it, and it's kind of a really vulnerable experience, because you know you're lying there and there's quite a lot of people down at the end of the table, and you know that you're basically naked and they can all see everything, and yeah, that is really not a very nice experience and it's very vulnerable. But the staff are amazing and they treat you with such dignity, and they really make it so much easier. So just be prepared. It is a vulnerable moment, but then childbirth is in general, so it's something we can't really get away from. That's the other thing I forgot to say. After they insert the spinal in your numb, they will put a catheter in, because obviously when you're numb you can't empty your bladder and you're not going to be able to go to the toilet yourself for 8 hours after. So they put the catheter in once you have the spinal in, so you can't really feel much, to be honest. And they tell you that they're doing it, but you don't really feel, you feel it going in, but it doesn't feel painful or anything. So yeah, once you're numb, then they will bring your partner in, whoever your birth partner may be, and they will have their scrubs on and everything, And basically what shocked us the first time was how quickly the surgery then started. Whenever Peter came in, they already had started to open me up, whereas we were kind of expecting he would come in and they might talk a little bit and then start. So it wasn't like that at all. It was just he came in and it was all go, surgery had started, I was already open. So yeah, something to maybe prepare your partner for. Something else that I wish I'd known is how quickly the baby is born during a C-section. The surgery itself can last quite long, up to an hour, but the baby's normally born within the first 15 minutes of that, sometimes even shorter. I think it was 8 minutes from the put knife to skin till Theo was born, maybe less actually. So the actual baby being born happens really quickly. It's the after part of the placenta and sewing you up after that takes the longest, but by then you have your baby in your arms, so you really don't notice the time going by. So something that I really wish that I had known before having my C-sections was how intense the pressure is. I always imagined, and I know it's a really common misconception, that you don't feel anything in a C-section, and so many people have said to me when I tell them I've had a C-section, they either say, oh lucky you, or that it was easy, or they say, oh but sure you don't feel anything. You do feel everything with a C-section. You feel all the pressure, pulling, tugging. If you've ever had a tooth out under local anaesthetic and had your face numb during it, you will know that although you can't feel pain, you can feel if someone's touching you, and when the dentist is pulling your tooth out, you can feel every bit of that pressure and pulling and tugging that the dentist is doing. It's just that the sharp pain doesn't come, and that is the same with a C-section. And I just think more people need to be prepared for that, and I'm not saying it to scare you, I'm saying it so that you go into it knowing that that's normal, because otherwise it could be really panicking for you whenever you get that intense pressure. Before I had my first one, someone told me that it felt like someone sitting on your chest. I didn't really get that experience, but I can see why they would feel like that, because this time whenever I had my surgery I had a little bit of a cough, and whenever I tried to cough when I was numb it was a wee bit scary because I couldn't, because you use your tummy to cough and I couldn't use the muscles in my tummy. So I found that I felt a little bit breathless during it, and it was a little bit, you know, it was scary not being able to kind of clear your throat and that kind of thing. And as well as that, it's really a shock how much pressure you feel up high in your belly, because even though I kind of knew to expect that I would feel something, I thought I would feel it down at the bottom of my belly where the baby was coming out of. Whereas most of my pressure was up at the top near my chest, and you'll see in the video of my C-sections that my body is moving loads on the table. And I described it as, it's like when a baby kicks you in the ribs, but it's like an adult. It just feels like somebody is kicking you full force in the ribs. That's the only way that I can describe it. It was intense pressure, but not painful, and if you can just keep calm and keep breathing through it, it is fine. But I can see how some people would panic, so just be prepared for those sensations and those feelings, and just keep yourself in a really calm place and know that they're normal when they're happening. And whenever we look back at the video of my baby being born, I could see exactly why I was feeling that, because the surgeon was pushing on the top of my tummy to move Theo out of my belly. So that is obviously that intense pressure that I was feeling. So another thing that I wish I'd known the first time around that I knew this time was how to know when the baby is close to being born. And the way that I knew that this time was when I heard a suctioning noise, which is them sucking up the amniotic fluid, as that means that they have got through the womb and are in through the amniotic sac, and they are very close to delivering the baby. So this time when I heard that suction noise, I really got excited, because I knew that that meant that Theo was really close to being born. So when your baby's being born, the anaesthetist will be looking over it, and they're the person who's at your head, so they will probably describe to you what's happening. Mine told me that his legs had been born, told me that he was definitely a boy. Obviously my babies were born legs and bum first, most cesareans would be head first, but yeah, she told me that it was definitely a boy. And then I asked if my husband could look over the screen and see the baby being born, which he wanted to do, and they said yes, that was fine, so he did that, and he also filmed the birth. They lifted Theo up, I got to see him. With Jonah I didn't get that because he wasn't responsive when he came out, so but Peter did get him being born on video as well. So yeah, that was lovely with Theo, that I got to see him being held up straight after he was born. So know that you're able to do that. You're able to watch your baby be born, and it will really help you connect to the birth if you do that, because it just makes you connect with the fact that they've come out of your body and they were a part of you, and it's just lovely. And in that moment you know that you really have given birth, and it's not just a surgery or just the baby's not being removed from you, but you have actually given birth to your baby, and it's just a beautiful moment. So as I said, the longest part of the surgery is after. You'll be given an injection to help pass the placenta, and it can make you feel a little bit sick, which it has done both times with me. The first time I felt sick in theatre, the second time it was after I got out of theatre, and it's a really overwhelming sick feeling. If it happens when you're in theatre, tell your anaesthetist, because they can give you a drug to take that sick feeling away immediately. Unfortunately with Theo, it happened to me after I was out of theatre, so I couldn't get that, but it did pass relatively quickly, so thankfully it wasn't too unbearable. You can get your baby on skin to skin in theatre. They'll be placed on your chest, and you can just enjoy looking at them and cuddling them while everything else is going on, and it's a lovely distraction while you're being stitched up and everything else is being sorted out. And then once that's all done, they will ask you to hand your baby over to your partner, and your partner will take the baby out of the room while you get then transferred onto a bed off the operating table. Again, this is when I started to feel really sick after Theo's birth, because they rock you to move you onto the bed, and I think a mixture of the medication and that just made me so queasy, and I felt really ill after, but it passed quite quickly, as I said. So you'll then be moved to a recovery room, and you'll stay there for an hour or two with your baby before you get moved to the ward. So during that time, basically the midwife will be doing observations on you, so they'll be taking your blood pressure, checking your pulse, checking your temperature every so many minutes, just to make sure that everything's okay with you. But while that's all going on, you can be having lovely skin to skin time with your baby and getting to know them and having your first breastfeed. So, or maybe you're going to bottle feed, but yeah, I had my first breastfeed in recovery, and I just asked that the midwife didn't intervene in that this time. I just asked to do that naturally, and that was lovely. I just put Theo on my chest and I let him latch himself on, and it was just the most beautiful moment, and I'm so glad that I got it on video, because it just makes me so emotional even thinking about it. It was just such a lovely moment. Yeah, so that skin to skin time together is just so lovely and so important to have, particularly after a C-section. If you want to breastfeed, it is so vital that you get your baby on skin to skin, because that is what will help trigger your milk to come in, and it will release all that lovely oxytocin hormone, which will help you to feel those lovely loving feelings towards your baby, and that's just going to help your breastfeeding relationship so much, because having a C-section, particularly an elective, can affect your milk coming in and can make it not come in till a bit later. But I must say that was a massive worry of mine with both my babies, and both times my milk has come in on day 3, which is really soon, and I put that down to doing loads of skin to skin and feeding constantly. So every time you can possibly feed your baby, you do it, because that is what triggers your milk to come in. I wish someone had told me not to stress too much about breastfeeding after a cesarean, because it has worked out perfectly fine for me with both my babies. My first time was really difficult because of tongue tie, but it was nothing to do with the C-section, and this time has been much easier, and we're doing really well, so try not to worry that it's going to affect feeding. So in recovery then, obviously your legs are still numb and you can't get up for 8 hours after your surgery. Some places it's 12 hours, my hospital was 8. So unfortunately, one of the really undignified things about a C-section birth is that you will have to have a bed bath from the nurses, and that does make you feel a little bit like an old person. You have to roll to the side of the bed and get washed down, and the nurses basically give you a sponge bath. So it's not the most lovely experience, just because you feel a little bit embarrassed and vulnerable, but to be honest, you will be glad of it, because you just feel a bit yucky after it all. So it is nice to get all freshened up, and they'll help you get into your night dress and out of your hospital gown at that stage. You'll then be moved around when you're ready. After having some lovely tea and toast and everything in recovery, you'll be moved around to the ward, Now, something that I didn't know before I had my first baby and I was prepared for this time is that usually if you've had a C-section you will not be able to be in a side room. I don't know how it works in America and places where you pay, but on the NHS my experience is that you have to be in a bay that is close to the nurse's station, because they need to be doing regular observations on you post-surgery, because after a C-section you're at quite a high risk of things like clots and things like that. So yeah, you're not allowed a side room, which is horrible because it's horrible having to stay on a busy hospital ward with the new baby, and that is one of the worst parts I find of having a C-section. So just be prepared for that, that even, you know, if you're in the UK you may not be able to have your private room if you're going through the NHS, because you will be expected to be in the ward that is close to the nurse's station. On your second night you could maybe get a side room. I did with Jonah, but this time I didn't really push it enough, and I was meant to get a side room but I forgot to remind them and I ended up not getting one. So yeah, it wasn't that pleasant being on a ward for the 2 nights. So be aware you can ask for it for your second night, but you'll not get it for your first night, or it's unlikely that you will. So about 8 to 12 hours after your surgery the nurse will come and she will remove your catheter. By that time you should be able to move your legs and feeling should be returning, and you will be starting to get quite sore once that wears off. You'll start to feel the pain of the wound and everything, but they give you great painkillers, so you know it's not unbearable pain because they do keep on top of your painkillers. And something I would say is, do not turn down the painkillers, take them as regularly as you can because you do need them, and you will need them when you go home as well. So after about 8 to 12 hours they'll come and take your catheter out and they will get you to stand up by your bedside. This is horrific the first time you do it, I'm not gonna lie. You do feel as if your belly is just going to burst open, and it is horrible. But it's totally normal, so don't worry if you feel really tender and really sore and as if everything is just so tight. The first time I felt as if I couldn't stand up straight for the whole first day. I was so scared to stand up straight in case I burst my staples or something, but it's honestly fine, and the sooner that you stand up and start walking the better. With both my babies I have got up within 8 hours, with my first it was even sooner, and as soon as I'm able to stand I start walking in and out to the toilet as regularly as I can, because the key to recovering from a surgery is moving as much as possible. So get that fluid moving around your body, get out to the toilet, even if it is brutal and it's killing you, just make yourself get up and do it, because it's just so important that you get moving and it's going to help your recovery in the long run. My advice in terms of recovery would be have a nursing pillow with you at hospital if you're planning, even if you're not planning to breastfeed actually, it's just so handy for when you're nursing baby that they don't put any pressure on your wound. And also you can just set them, when you're changing nappies and everything, it's really handy to set them in because you can't get out of bed for the first while. Be aware that there are some things with C-section that you will be suffering with. So well, in general after birth you will have after pains, which I didn't know about with my first. As your womb shrinks back to normal you will get contractions as it shrinks, which are much worse while you're breastfeeding, and they get worse with each baby you have. So with my first I didn't get them that badly. With Theo, oh my goodness, they were absolutely brutal, horrendous pain. So just be prepared for that. It is not very pleasant, but the painkillers do help with that as well. Another thing that can happen with a cesarean, because your body has been open, air can get into your body cavity and give you really bad trapped wind, and I mean it is brutal, it is so painful. It is really bad, so just be aware of that and take precautions to try and get that moving. Some of the things that people told me was to take chewing gum with me to hospital, because chewing gum can help to get trapped wind moving. I drank peppermint water, I asked the midwives for that while I was in hospital, and that really helped as well, although be aware it can affect your milk supply, so try not to take too much. But I found that even just going into the bathroom and just rubbing my stomach repeatedly, I could actually feel the air bubbles, it was horrendous. But I just kind of rubbed it from right to left, and that helped to move the trapped wind. And if you've ever had a surgery before like this, you'll know whenever you get trapped wind pain after a C-section, it can not only give you the pain in your tummy, you get what's called shoulder tip pain, which is a trapped wind pain that goes right to the tips of your shoulders. It's really hard to describe if you've never had it, but if you get it you will know about it. It's just really, it's not a very nice feeling. So just make sure you ask the nurses for peppermint water if you need it, or peppermint tea or things like that, to just help to move that along. And also obviously after having a big surgery like a C-section, your bladder can be affected and your intestines can be affected, because both have been moved during the surgery. So, and as well as that, you've taken a lot of painkillers and medications and things like that, so your bowel and your bladder can both be quite funny after. So for the first 24 hours after having the C-section, you have to let the nurses know how much you have paid, and you have to tell them the volume, which is a bit embarrassing. But yeah, try and get up and use the bathroom as quick as you can. In terms of number twos, it might not happen for a day or two because your intestines are like just shutting down because of all the medication and being lifted out of your body basically. But yeah, just keep on top of that, because it can make your incisions so much more painful if you haven't been able to go to the loo. After you have a C-section, coughing, laughing, sneezing, everything like that is going to be really painful, and it really does hurt, so be prepared for that. And whenever you need to cough, laugh, sneeze, anything like that, press a pillow into your incision, like put some pressure on it, because that will help to take the pain out of it. I also bought a belly compression band this time around and wore it during my recovery, and I found it really helpful as well. It just velcros over your belly and puts pressure on, and I found that it helped with the trapped wind. It helped to move fluid on out of my stomach, and it just helped me to feel that everything was kind of held together, and that getting up off the sofa, things like that, was just so much easier while I was wearing that. So I would definitely recommend getting one of those. Something else that no one told me about was that some people, now not everyone, you might not experience it, but quite a lot of people do, is that after having a cesarean and having a spinal, I think this can happen if you've just had an epidural for a natural delivery as well, some people take a reaction to the spinal, which is an itch, and it is the most horrific itch that you will ever experience in your life. And it lasted with me both times. With Jonah it lasted 24 hours, and with Theo it lasted 28 hours. An itch over your whole body, your scalp, your back, everything. I just wanted to tear my skin off with it. So this time I had packed a back scratcher because I had the reaction with Jonah. So at least this time I had that, but it still was pretty unbearable. They can give you antihistamines which take the edge off slightly, but it doesn't get rid of it altogether. So yeah, just be aware that that can happen. Have a back scratcher with you, and that's also another really good reason to get up and have a shower really soon, because the shower is lovely and soothing for the itch as well. So just be prepared for that, and try and get up as soon as you can so you can get freshened up and have a shower. Something else just to be aware of, that I know some people don't realise, is that even though you've had a cesarean, you will still bleed after birth. It will be like a period for, it can be anything, I think, from 2 to 6 weeks. So just be aware of that. Make sure you take plenty of maternity pads with you, and be prepared, you're going to be bleeding for quite a while. As well as that, because of the risk of blood clotting after a cesarean, you have to wear compression stockings on your legs, and you also have to get daily injections for 10 days after. So it's a drug called gezzcanezz, which is to help prevent blood clotting. So you either have to give yourself the injections or a partner. So I got Peter to give me mine because I just couldn't bear to give myself an injection. So it has to be injected into your tummy for 10 days after, and they're not terrible, but they're quite a stinging injection. So yeah, that is something else that you have to go through with a cesarean. So obviously once you get home, you aren't really able to lift anything heavy for at least a few weeks. They recommend 6 weeks of only lifting something as heavy as your newborn, but when you're a mum of 2, that's just easier said than done. So I'm currently 2 weeks post C-section, feeling quite good now. I would say the first 4 days were the toughest, and the first couple of days I just really was in a lot of pain, especially the first few days at home. But after that I turned a corner, and we've been getting out of the house plenty, been walking lots and getting moving, and my belly's going down quite well, although I do have quite a flabby overhang this time, which is horrible, and I'm really not as happy with my scar this time. It's definitely not as tidy, but it's a small price to pay for this lovely little man I have here. So yeah, don't expect your body to just bounce back too quickly after a C-section, because obviously a lot of layers of your belly has been cut through, and it's not going to sit flat for a long time. So just be aware you will have a little bit of an overhang, and the scar might not look too pretty to begin with, but it will fade with time, and you know, it's so worth it when you have your baby there anyway that you'll not mind. So I would just recommend the first 6 weeks after a cesarean that you take it really easy. With Jonah, I did take it easy for 6 weeks, and I was back on the horse by the end of those 6 weeks doing light work. So I really think because I took it easy to begin with that I recovered quite quickly then. So I would just say make sure you have plenty of help and people to help you with any heavy lifting, and just focus on looking after your little baby and feeding in those early days, and don't strain yourself too much. So I think that's it for all my C-section tips. I hope that it's been helpful, not too long-winded. Let me know in the comments if you're planning a C-section soon or planning on giving birth, and if these tips have been helpful for you, and I will see you guys in my next video. Bye!